All right. Welcome back, everyone, to another virtual shouting session at Hearts for Health. This is actually our 60th virtual shouting session, so another milestone. But today we're joined by Dr. Samy. He's an otolaryngologist at the University of Cincinnati, Gardner Neuroscience Institute, and also the Skull-Based Surgery Fellowship Director at the UC College of Medicine. I have a few reminders for y'all before we get going. I know that some of you are new to the program, given that we're just into a few sessions in this spring semester. By the way, I hope y'all are doing well with your courses and starting off the spring semester well. But for those who are new, just a few things. We have a Q&A at the very end of each of these sessions. So if you have any questions for Dr. Samy, feel free to type them in the chat. The chat is either to the right of this live stream that you're viewing or to the very bottom below this video. So feel free to type them in as we go. You can type them in at any time, even while we're during the Q&A, you can still type them in. We'll try to get through all of them, and we'll go through them in the order that we receive them. That's one thing. Another thing is, for those of you who want to stay updated with virtual shadowing sessions, we have two typically each week on Mondays and Thursdays at 7 p.m. Central. If there are any changes that you will know, either through our Instagram page or our email listserv. Our Instagram page is just something that you can follow, so pretty simple there. With our email listserv, you can either email us at community.h4h@gmail.com, and you'll be added on to our listserv, or you can subscribe on our website. Our website is hearts4health.org. At the very end of the webpage, or any webpage really, you'll see the subscription request on the left side. Fill it out and you'll be good to go. So those are two ways to stay in tune with us. Both of them have flyers, both the email listserv and our Instagram page. So you really will not be missing out on anything either way that you go. Our email listserv does have a few more opportunities though in terms of programs outside of virtual shadowing. We have a few more updates there, but we still try to keep it even in terms of how we get around our announcements. With that said though, those are all the reminders I have. If any of y'all have any questions outside of what I just mentioned, feel free to email us at the same email I provided earlier. But I don't want to take up too much time, so Dr. Samy, feel free to take it away.
Wonderful. Thank you, Michael. It's a pleasure and honor to be here. Hope you can hear me very well. And I wanted to start off with some photos of Cincinnati. I've been here now 17 years. It's a beautiful city. I think there's mourning since the Bengals lost. They were hoping to get back to the Super Bowl this year, but that's okay. Maybe next year. I've been at University of Cincinnati and Cincinnati Children's all this time, and things have changed since you and I talked initially when you asked me to do this. I actually have left University of Cincinnati. I'm taking a different role, and I'm moving on. Let me see if I can faster. I don't know why there we go. Before I talk about that, I loved looking at your website and seeing what all you guys are doing. I think these webinars are phenomenal. I think the ability to have people from anywhere around the country and around the world tune in is wonderful. But one thing you have to remember is none of this replaces time in the clinic, time spent with physicians, surgeons, PAs, nurse practitioners. The more you have that hands-on experience, the better. And it keeps you that passion going. And the idealism of youth, I always like. And I love this photo of you, Michael. I got it off the website. You look like you're 15. I think in real life, you don't look much older than that, but I love this. And is that sister or wife?
That's my sister.
Sister, got it.
Yeah.
So congrats to the two of you. I love it. Keep up the enthusiasm and do these kinds of things. So I'm going to talk, Michael and I talked over the weekend, I said, hey, tell me more about what you would like me to talk about. I'm going to talk about something called chronic otitis media. It's a very common talk I give. And this, by the way, is my new position. So I have always been in academic medicine. I went to Duke University for undergrad, worked in David Sabison's lab, and he was very well-known, a prolific author and chairman of the Department of Surgery at Duke for 30 years. It's a Sabison textbook of surgery that some of you may have seen. He is my first role model about academic surgery and what it means. Very much a Southern gentleman, and he addressed each person very formally, always wore a coat and tie. And he taught me early on in my career that it's important to treat each patient that you see in a very dignified and compassionate manner. And he said that patients, you are given the privilege to touch a patient, that a patient does not have to allow you to touch him or her. And the fact that you, especially as a surgeon, you're doing very invasive things. I've never forgotten that, and it's stuck in my head. So I was at Duke for undergrad and med school, Stanford for residency. And that, as my years went on, I had different mentors and different colleagues and now friends, of course, that I have learned so much from, and they guided in my path. So after finishing up at Stanford for residency, I went to the University of Iowa for fellowship for 2 years, focused on neurotology, skull-based surgery. It was at UT Southwestern Medical Center in Dallas for 3 years. As I rose through the ranks and published and ran fellowships, all these different things, and I'll be 54 this year. My goal really is to say, okay, what can I do to head or chair an otolaryngology head and neck surgery department? And so I'll be starting at Lehigh Valley Health Network on March 6th. There's my email. If any of you are ever interested or in the Pennsylvania area, so Lehigh Valley is northwest of Philadelphia, west of Manhattan, so about an hour northwest of Philly, 90 minutes west of Manhattan. Feel free. I always love having observers in my clinic. Love having them in the operating room because that allows them to see some of the neat things that we do. So email me if you have any questions. So conflict of interest, none of these will pertain to what I'm talking about today, but I really like to do clinical trials. What's amazing is one of my favorite procedures is cochlear implantation for deaf kids and deaf adults, and it's life-saving. But I think what's amazing is we're entering an era of injectables. So the bottom two companies, I won't discuss any of these three companies today, but the bottom two are working on ways to inject medicines through the eardrum as a way to regrow hair cells in the cochlea and treat hearing loss, treat tinnitus, and treat things like dizziness. So I think the future is very bright for all these different areas. We just started residency at LVHN, so I'm very excited about that, and happy that as the group grows, the more youngsters I notice we have around us. I actually love it when high school students are involved, undergrad, med school, PA school. I think it creates a sense of a lot of questions that are always being asked. There is no dumb question. And things that you would think people know the answer to, I think we all assume. So it's exciting to see a residency start there, in addition to having a fellowship. So chronic otitis media. So the word chronic means long lasting. And some people define chronic now, depending on the disease process. Chronic sinusitis, chronic otitis refers to the ear, media refers to the middle ear. You know, there are many kids, something like 85% of all kids in America have at least one ear infection. I've got twin daughters who are 14. One of them needed PE tubes to drain her ears. She was getting speech delayed. And since she has a twin sister who was very advanced in her speech, we could see the disparity between the two very quickly and easily. So that's acute otitis media, right? When you hear about little kids getting infections, it's very, very common. Chronic otitis media is a different process. It's long lasting. And what's often associated with chronic otitis media are things such as, I don't know, I can't see them. Let's see if I get a laser here. I don't know why. Can you see a laser at all, Michael?
No.
Let's see if there's a way to do that. Annotate. Control more. I had this problem the other day with Zoom, and I don't know why I couldn't get it to work then either.
Is it PowerPoint or Google Slides?
This is a Keynote.
Oh, okay.
So let me see if I can. It may be a Keynote issue then. Select mouse. Okay. If it doesn't work, it's not a huge thing. Let me try one.
You want to highlight with your cursor?
Yeah, but it's funny when I take the cursor off that top, I don't see it anymore. Like it disappears on the screen.
Okay.
Okay. All right. So it's okay. What I'll do is I'll talk through this for you guys to see. Let me see if I get that. Can you see if on yours, if you can say, give control to me, is there a way to say, give control for a mouse or laser pointer or anything like that? And the other option, I actually did this. Let me try this, Michael. The other thing I did is, I think I escaped and try to do it that way. No. Is there a way for control on your end at all?
I'm trying to look into it. I'm not too familiar
Okay.
with it, though.
That's all right. So what I'll say to you here is, on that picture to your right, that area of white, that's the eardrum at the bottom, but at the top, that's the area of white. That's called a cholesteatoma. And that's actually a collection of skin cells. It's basically a simple way to think about it. Cholesteatoma is a skin cyst or skin in an abnormal location. And what's amazing is the way our ear is designed, it's actually meant to be self-cleaning. So because the eardrum is deep down, it's almost like at the bottom of a cylinder. What we think of as wax, part of that's wax, but part of it's actually also dead skin. Cholesteatoma is when these skin cysts continue to grow and grow and grow, usually due to eustachian tube dysfunction, right? So all of you, when you're flying on a plane, as an example, or where you're going up and down a hill, you have to pop your ears. Well, some people don't have eustachian tubes that work well. And so because of that, you can get a lot of ear infections, ear disease. And the sad part is chronic otitis media, I think overall we're doing better than we used to in the US because we have good access to vaccinations, antibiotics, PE tubes, all these things. But if you go to places like India, where I was born in India, I was born in Madras, India, anywhere from 1 to 2 to 3% of the population can have chronic otitis media. No one knows the exact number. But if a country of about 1.1 billion people, that is a massive number to have 1 to 3% of the population affected. So this is still a problem for countries like India, China, Africa, South America. So whenever we deal with surgery, and I don't think it's just for chronic otitis media, you got to think about, you have to be goal-oriented, systematic. You have to end up thinking in your mind, how do I approach this problem? But then no two patients are alike. So that's why I say at the same time, be flexible, because patients are not machines. If I was operating on Michael versus his sister, they may have different ideas about what they want me to accomplish for them. And I think that's where there's the give and take. Medicine is a science, but it's just as much an art form. And as you have to, as the physician or surgeon, really do a good job building rapport with your patients. I think the idea of rapport and trust, if I could get you guys to think of one thing for the end of this lecture, is that ability to create rapport and trust is incredibly important. For chronic otitis media and a lot of reasons for why we operate, we're trying to avoid complications. Sometimes, like for example, if I don't operate on cholesteatoma, you can actually get brain abscess. You can get meningitis. You can become completely deaf. You can have facial paralysis. You can have dizziness, all these different things. And then goal is to, once we take out these skin cysts, I call them tumors because I know I have a lot of patients who I have to make sure that if someone's got a 6th or 8th grade reading level, that I don't make it complicated for them. So I'll say, you have a benign tumor of your ear. It's not cancerous, but if we don't take it out, then there's a risk of having serious complications. Or there's also the risk of this coming back if we don't take it all out. And then other things that are important, cosmetics is important, trying to maintain the normal anatomy, right? All those things are important, but you have to really prioritize what's important to us as physicians and surgeons. And each patient that comes in needs to be treated like that's your family member, that's your friend. It's very important to me. All right, now let's see. I'm gonna see if I can stop share for a moment. Maybe that will stop it. For some reason now it's frozen. I can't even.
You want to try hopping back out and in of the meeting?
Yeah, that may be the best way. Let me try that. Oops. Are you able to get me to stop sharing? Since you have control, you may be able to say stop share.
Only choice I see here is remove from the meeting. Is that all right?
Yeah.
And then you can try to join back in. Okay.
Yeah, I'll do that.
All right. Let's just give Dr. Samy a quick moment. While we wait, if y'all have any questions, feel free to type them in the chat. We haven't got through much, but in general, if you have any questions about the specialty, or let's say anything that Dr. Samy hasn't covered yet, feel free to type that in. All right, apologies for the delay, y'all. So what we're gonna do is we're gonna get back on board, but we're going to use a different live stream. We're gonna hop onto a different live stream. All right, so please stay tuned. Just refresh our live page. In the next 5 minutes, we should go live. All right. So we're going to get everything back up and running, but just give us 5 minutes if you could just bear with us for that. I really do appreciate y'all's patience, but we'll be right back with you for Dr. Samy to continue his presentation.